Child affirming care, i.e. child mutilation. Surgeries gone horribly wrong.
What the fuck?
Surgeon gets called out. Sadly, it's back to Groomerville.
What the hell's going on out here?
I'm Jasper Gonzo, and this is what's next. Hey, what's up, guys? Jasper Gonzo, what's next? Hope you guys are doing well on this day. Of course, as we approach our weekend, it's always a good thing. Sadly, we have to take the trip back to that wonderful place called Groomerville. A lot of it hasn't gotten much play as of lately, only because with the situation going on with the McCarthy soap opera in the House, and of course you have Twitter files being dropped, and of course dementia doing what dementia does. But these shenanigans, these destruction, this demonism continues to rage on across the country, and of course stories are still coming out about it. This one in particular, in Florida. A Miami surgeon, a trans surgeon, you have surgeries gone wrong. You have patients coming out and saying, you destroyed my life, but remember, child affirming care. It's all for the children. Let's take a look. This comes out of the post-millennial. Former patients of Miami sex change surgeon Dr. Gallagher, if I'm pronouncing that right, I don't care at this point, come forward about gruesome post-op complications. The Miami surgeon who specializes in amputating the healthy breast of teenage girls. Yes, Susie, you're healthy, but you may be a boy, so we're going to have to lop off your breasts. And young women and advertises her services directly to vulnerable young people via social media is facing backlash from several former patients who say they experienced severe post-op complications. Dr. Gallagher, the celebrity surgeon who jokingly refers herself as Dr. Teetus Deletus, wow, has been under increased scrutiny since one of her obese, because that's a safe thing on its own. Sure, not only are you overweight, but we're going to lop off your breasts. Jokingly refers herself to, has been under increased scrutiny since one of her obese trans identified biological female, quote unquote, males, told the harrowing tale of experienced life-threatening complications after undergoing Gallagher's knife. Daily Wire investigation from Christina Buttons has uncovered 5 more overweight former patients claiming to have suffered similar complications following bilateral mastectomies performed by this asswipe Gallagher. Given the increased risk of complications when operating on overweight people, just in general, it is an increased danger. Most plastic surgeons have BMI cap for elective surgeries. Gallagher, on the other hand, has no such requirements. No. It's all safe. Why? Because I'm the doctor. On the other hand, has no such requirement. She is willing to operate on patients of any shape or size, according to Daily Wire report. Her own published research indicates that around 54% of her patients are obese. Quote, in an effort to be inclusive, diversity, inclusive, as possible, we do not have an absolute cutoff on BMI requirement for patients who are interested in undergoing the knife, reads the information section on Gallagher's website, which goes on to claim that Gallagher specializes in providing top surgery to higher BMI patients and ensuring safe and natural results. Again, listen to me, I'm the doctor. Rylan, whose gruesome story went viral on several social media platforms last month, was one of those obese patients. The young trans identified quote-unquote female, a guy, after travel from Ohio to Florida for the procedure because Ohio said, we don't do that, after being unable to find a surgeon closer to home who was willing to perform it. Complications started on day 4 with the appearance of a hematoma, and things got progressively worse when the incision opened, became infected, and started to rot. Rylan alleges that Gallagher didn't take the complications seriously and even true to style had a cutesy name for the gaping wound, a blowhole. Nice. The nightmare ended with a youth having over half a foot of dead, rotting tissue removed after weeks of agonizing pain. Yeah, because you got to remember, it's child affirming care. But after Riley's story went viral, Buns reports several other obese former patients, celebrity, quote, gender-affirming surgeon, recounted their own alleged tales of complications in a private 32,000-member Facebook group for top surgery patients. These are not isolated incidences. This happens a hell of a lot more than people think. The, quote, trans-identified female from Oregon with a BMI of 55.8. Normal range is 18 to 21, which is classified as super morbid obese, turned to Gallagher for breast amputation after a local surgery required a weight loss of 25 pounds prior to surgery. This patient, like Ryland, developed a, quote, large blowhole 6 days post-op. In Ryland's case, the young patient reports that Gallagher brushed off concerns instead of advised letting it drain. 3 weeks later, the patient ended up in the ER where lab tests confirmed a staph infection, and an emergency procedure was performed to drain large fluid abscess that had formed. Despite all this, the, quote, trans-identified female has plans to undergo gender-affirming hysterectomy next. After all the shit that's happened to this dude, he is still going with the mental illness. Wow. Another overweight former patient, this time in Oklahoma, also claims to have developed serious post-op infection and reports struggling to be taken seriously by the celebrity surgeon. Gee, I wonder why. I developed an infection in 3 spots and pushed hard for antibiotics. The patient said in a closed Facebook group. She was, quote, she wasn't very communicative with me. I blew up on the phone and her office phone to get a response. She kept telling me to put over-the-counter antibiotic ointment and it would just go away. Just spray some Windex on it. And until it was spreading and opened, and then she prescribed me antibiotics in pill form. Took all of them, did nothing, the young patient added. A similar story was told by another obese, quote, trans-identified female from Illinois who also experienced several open, oozing red spots that were painful. Gallagher allegedly said that, it's normal. Another California patient ended up in ER with a post-op infection, fever which required 2-day hospital stay. Lastly, a female patient who underwent a medically unnecessary bilateral mastectomy when weighing 250 pounds, also described the incision opening resulting in serious infection. The fact of the matter is that when that this first patient, this one who exposed this ass clown surgeon, still will go under the knife to finish the job. Again, mental illness begets mental illness. When you have this kind of garbage, this evil, and instead of saying, hey, you know what? Let's go for therapy. Let's go for a psychological eval, Do you have a church? Would you like to talk to your pastor, your priest, your rabbi, so forth? No, we can't have that. Hormones, surgery, that's all you get. That's why you have situations like Boston. That's why you have situations like Vanderbilt. It's the reason why you have situations now in Florida, of course, under DeSantis's rule, not DeSantis' rule, but DeSantis' governing, that even with everything that he's done, you're going to still have shit like this happen because it's going underground. A lot of this stuff is going underground. When you have people reaching out on social media to find so-called surgeons that will, put you under the knife, don't worry about it, Remember some of the movies back in the day that you would watch and, I had to have this medical surgery and blah, blah, blah. Yeah, we're going to take you over the border of Mexico. You got doctors there who will do the job, don't have to worry about, this drug or that drug or this complication or that complication or you have to meet this standard or that standard. No. That's okay. It's no longer the movies. This shit is happening right here, right now. And this is sadly going to continue. And I'm glad that you have the Daily Wire continuing to expose shit like this, not just Matt Walsh, but others who are continuing to expose this shit, like the post-millennial and others. So it's sad. It's truly sad that you have young adults, you have young children, you have young people, sadly under age of not just minors, but under, in their 20s, in their 30s, who are relatively healthy. And then you have those who are obese, who should be losing weight to improve themselves from a health standpoint and from a mental standpoint. No, I feel like a woman. Or no, I feel like a boy. And I need to get my breasts lopped off, and I need to get my balls chopped off. Gruesome, pathetic, demonic. I'm Jasper Gonzo. This is What's Next. Want to see more Jazz Next? Please leave a comment below. Like it, share it, subscribe to it. And we'll catch you guys again. Peace.